Doctors know the medical world inside and out, so it's always interesting to find out which medications they steer clear of, even though they're readily available over the counter. While these meds are familiar names in many of our households, doctors often have insight into their hidden side effects, questionable effectiveness, or potential for long-term harm. Let's dive into 5 common medications that many of us take without a second thought, but that doctors often avoid like the plague. 1. OTC sleep aids, diphenhydramine-based. Sleep aids, like Benadryl, with diphenhydramine as the active ingredient, are a go-to for millions battling occasional insomnia. However, many doctors avoid using them for a good reason. Diphenhydramine, an antihistamine, has some pretty unappealing side effects, especially if used regularly. It can cause grogginess, memory issues, and even a hangover feeling the next day, defeating the purpose of a good night's sleep. Long-term use can affect mental clarity and increase the risk of dementia over time. So, doctors typically recommend other sleep techniques before turning to meds. 2. Antibiotics when not absolutely necessary. Doctors know the importance of antibiotics in fighting bacterial infections, but they also know how dangerous overuse can be. Many people request antibiotics for colds or sore throats, even though these illnesses are often viral and unaffected by antibiotics. Misuse and overuse of antibiotics have contributed to a rise in antibiotic-resistant bacteria, which is a major health concern globally. Doctors often save antibiotics for when they're absolutely necessary, rather than risk creating superbugs. 3. Proton pump inhibitors, PIS. Popular heartburn drugs like omeprazole, Prilosec, and esomeprazole, Nexium, work by reducing stomach acid, giving relief to millions with acid reflux. However, doctors are cautious about using PCs for more than a few weeks due to potential long-term issues. Regular PPI use has been linked to kidney disease, nutrient deficiencies, and increased susceptibility to infections like C. difficile. Doctors typically suggest lifestyle changes, such as avoiding trigger foods and not eating late at night, as first-line solutions. 4. NSAIDs, non-steroidal anti-inflammatory drugs. Ibuprofen, naproxen, and other NSAIDs are popular for everything from headaches to joint pain. While effective, these drugs can wreak havoc on the stomach lining, kidneys, and heart, especially if taken regularly. Doctors often turn to alternative pain management strategies, such as physical therapy or acetaminophen, which doesn't carry the same risk for stomach ulcers, to avoid the downsides of NSAIDs. Or 5. Cough syrup, especially codeine-based. Codeine-based cough syrups are sometimes recommended for severe coughs, but doctors are wary of their risks, particularly their potential for dependency and respiratory depression. Even non-codeine cough syrups don't fare much better. Studies show they're often no more effective than a placebo. Many doctors prefer simple remedies like honey and lemon in warm water or steam inhalation to soothe a cough rather than risking the side effects of syrup.